Hi, everyone. My name is Dr. Taylor, and I'm here with some other pediatricians from the University of Minnesota. This is Dr. Alex and Dr. Rashedat. We're here to talk to you guys today about COVID-19 and ways to keep yourself and your family safe. So first thing is, what is COVID-19, you guys?
Everyone's been asking that question lately. COVID is an acronym for a germ. It's a virus that can make people sick, and it's spread from one person to another.
And how does it spread?
So it's spread from spit particles when you're talking, when you're sneezing, coughing, snot from your nose, when you share drinks and bottles that you have put in your mouth or that has come in contact with snot from your nose. Mm-hmm. Those are the ways it can spread.
So, Dr. Alex, if I get COVID, what will happen to me?
Yeah, Dr. Taylor, that's a good question. There's a complete range of things that could happen. On one end of that scale is you could feel completely fine, but still be at risk of making other people around you very sick. Mm-hmm. The most common symptoms we see are things like fever, cough, sore throat, runny nose. You can get body aches and fatigue, feel really tired and down. The more severe end of the spectrum is people who end up having trouble breathing and needing to come into the hospital and end up on machines to help them breathe. So it can be very serious. It's also very important to remember that most children and young kids who contract this do very well and end up having more mild symptoms. We get concerned that they might spread it to more vulnerable populations, people like their grandparents or their parents, or people with health conditions that might prevent them from fighting off the disease like children can.
All right, Dr. Alex, what do I do if I'm feeling sick?
Most important thing you should do is call your doctor, make an appointment. Our clinics are open all across the city. Be seen. Go to one of the walk-up clinics. There are plenty of walk-up clinics available throughout the city as well. No appointments necessary.
And if you do get sick, make sure to stay away from others because you don't want them to get sick, especially people who are older. For example, your parents or grandparents, only because we know that they do get sicker when they get this germ infection.
So, Dr. Rashedat, how can we prevent the spread of COVID-19?
Data has shown that these practices does help to stop the spread of the infection. So, first thing I would say is wear a mask. Any kind of mask is fine. The surgical ones or the cloth ones, either one is fine. Make sure that when you wear them, they are covering your nose and your mouth, not just your mouth or not just your nose. Make sure that it fits comfortably against the sides of your face, and also make sure that it's secured. So, there are some masks that have the loops, and there's some that is just the string that you tie behind. So make sure it is secured, so there isn't any hole or space, and make sure that it allows you to breathe, so it's not restricting your face and you can breathe comfortably wearing the mask.
Great. Dr. Alex, will you show us how to put on a mask?
Happily. So I have my lovely University of Minnesota cloth mask here. Here are the ear loops. I put one end over the top of my nose, loops around the ears, press it so that it is flush against my face. Make sure I take some deep breaths and don't feel air blowing up into my face or out the sides.
Mm-hmm. Because not only does that mask protect you, it protects others, right?
That's absolutely correct. And sometimes it helps to make some big expressions so that you know your mask will stay on.
Dr. Rashedat, who should wear a mask?
So everyone should be wearing a mask except kids less than 2, only because they're so little and it's so hard for them to keep it on. So we should all be wearing masks.
Dr. Alex, how else can we keep ourselves safe from COVID-19?
The next best thing we can do is wash our hands with soap and water for 20 seconds or more regularly. And if we're on the go and we don't have soap and water available, hand sanitizer is also an option.